My name is Analisa Quintero, and my project that I wrote was on mitigating the immigrant health paradox for undocumented immigrants with Medi-Cal. So many of you might not know that undocumented immigrants actually make up a significant portion of the population in California. It's about 22%. So that's around 2.3 million people who were not eligible for any form of Medi-Cal until very recently, and some still aren't eligible until 2024. And so with this recent expansion of Medi-Cal to include all, the focus should be for the state to focus on this population actually accessing the medical services that they are newly eligible for and that they need. And my problem statement for this project was, in order to ensure the long-term health of undocumented immigrants in California, they need efficient and comprehensive healthcare to combat the immigrant health paradox. And so some history of policies leading up to this. It all started in 2016 with the passing of Health for All Kids, which expanded Medi-Cal to all children under the age of 19. And this one expansion actually in the first year enrolled over 180,000 children in California. So this is a pretty big expansion. The two recent expansions were Health for All Young Adults between 19 and 25, and Health for All Elders, which was all seniors over 50 years of age. And so the future implementation of this program is going to be the 2024 expansion, which is Health for All, which is the final Medi-Cal expansion to the little age gap of 26 to 49-year-olds. And so healthcare access is obviously a very important driver in quality of life for all Californians and people in general. But I previously explained the policies leading up to this expansion. And another important portion of this project was explaining why this issue is worth government intervention in the first place, besides the obvious fact that people deserve healthcare. And so undocumented immigrants actually have some of the lowest health outcomes in the state. And our healthcare system as it is now has a lot of negative externalities. Rising healthcare costs are an issue for everybody in the state. Undocumented immigrants are a lot more likely to face higher rates of disease transmission in their communities, especially with COVID, and lower worker productivity in populations exists with populations with lower health coverage. So this is a really big issue for undocumented immigrants. And undocumented Californians actually contributed $37.7 billion only in taxes. This doesn't even count spending power to the state in 2019. And so in my literature review, I covered a couple important topics. The three main topic sections were acculturation, the immigrant health paradox, and what this means for healthcare access. And so acculturation is a process that immigrants face where they adapt to the new culture of their environment. And this plays right into the immigrant health paradox. It's called the immigrant health paradox because immigrants tend to have a lot lower self-reported health rates, even though they're a lot less likely to participate in harmful health behaviors like excessive drinking, excessive smoking, and other harmful health behaviors like that. And this sort of goes on with, as the longer they stay in the United States, the worse their health actually gets, which is kind of weird. And it's, a topic of interest for people who are interested in this healthcare issue. And so uninsured immigrants actually have a stronger association between the length of their time in the United States, like I stated, and a worse change in health status than with those with health insurance, for obvious reasons. If they don't have access to preventative care, then their health will slowly diminish as they stay longer in the United States. And so in my analysis, I used a criteria alternative matrix to analyze three policy alternatives. And I used three criteria in this analysis as well. I weighed cost effectiveness the highest because of, as Christian says, the impending financial doom that we have coming for us here soon. And so that's why I weighed that the highest. So I had three policy alternatives, like I stated. One is a Medi-Cal program assessment. Two is an incentive to increase Medi-Cal enrollment. And three is a preventative health education program. So the first one, the assessment is supposed to be an assessment after the first year of the final implementation of the expansion and 5 years after the final implementation of the expansion. The second one is a $25 incentive program to new enrollees up to $25,000. And this includes children, adults, anybody of this newly eligible population that would be willing to enroll. And the estimated cost of that was $625,000. And then the final alternative was a program creation for a preventative health education program here for undocumented immigrants in California. So in my analysis, I described how well each of these alternatives met the criterion qualitatively, and then I added a quantitative quantitative value to each of these as well. And so the first alternative is an indirect method of solving this issue, but it is cost effective and it is the easiest to implement because it's just changing the focus of the Medi-Cal assessment rather than creating something new. The second alternative is also, is a direct approach to the issue instead of indirect. It's cost effective, but the difficulty would be finding funding for that in the first place. Something is similar happened with COVID where they did vaccine incentives, but that was kind of like a special case. And then the third alternative is another direct approach and is super cost effective long-term, but the difficulty lies in finding long-term funding for a program that would sort of have like smaller wins as time goes on. So my recommendation for this issue, the initial recommendation is to just implement the Medi-Cal program assessment, changing the focus to focus more on the number of people that are actually enrolling that are newly eligible. And then I also included an optional recommendation, which includes recommending all three of the recommendations that I came up with, but sort of like in succession with each other. So the first one would be to look at the enrollment numbers and see if we need an enrollment incentive program to really get those numbers up. And if we don't, then obviously we don't use number two. But if we do, then we can use number two. And then also the third education program can be implemented after the second one or as a standalone program to help California mitigate this health gap. And that's it. Anybody have any questions?
Is there like political will to make this happen?
Make which one happen?
To cover undocumented people through Medi-Cal?
Yeah. Yes. So I don't think Governor Newsom would have signed it if there wasn't any political will, because this wasn't like a bill that went through. They've tried to pass, I think, 2 or 3 bills now. But Governor Newsom actually just signed the final expansion in himself. So there's a lot of backing from community-based organizations and obviously healthcare institutions. It's more cost effective to provide preventative care than to provide constant emergency care. So that's another thing that's been sort of in the background. Thank you. Yeah.
Younger age groups saw like good returns right in enrollment.
Mm-hmm.
Is there anything that you can draw conclusions from why this age group would be different? Why they're finding enrollment there?
So well, obviously, I think people are a lot more likely to seek preventative care for their children because obviously, when you're younger, your health matters a lot. Like long term, a lot of your health will depend on whether or not you were healthy as a child. But I think also they just made it a lot easier for them to enroll their children. There was a transition of care program that was implemented when children were moving from a different program to Medi-Cal, but they haven't really done anything similar for adults. Okay.
And again, I find myself asking a question about something I know nothing. But I wonder, in some senses, fortified as prepared, right?
Mm-hmm.
I'm wondering if in the research you found any evidence of having learned from the previous attempt at enrolling,
Mm-hmm.
that might already be baked in, or that were tried and discarded.
Not really. I couldn't find anything. It seemed like the state, as far as I could tell, just opened the enrollment, but didn't really do anything to sort of get people to enroll in the first place, which was weird to me, but yeah. Oh, one more, sorry.
program.
Mhm. Yeah, that was something I was really interested in, but I wasn't able to explore more, was actually the effectiveness of Medi-Cal as like a program itself. In general, all of the literature that I could find about like why we should expand Medi-Cal was like, Medi-Cal is great. Everybody uses Medi-Cal when they have it. But besides that statement, there wasn't really any data to back it up. But I mean, in general, it has improved health outcomes of previous populations. So I'm not sure. I mean, personally, I have Medi-Cal and I don't really use it that often. So I get that.
Feel like there's a need for the federal government to implement this, maybe, the chairs and all the words. California can also follow the lab with Medicare.
Yeah, I think California right now is kind of leading the charge. We're actually the first state to ever open like the state healthcare program to everybody. But I know that some other states are definitely looking to California right now to see if we can be used as like an example of like why we should implement this change. But until we have more information about how many people are enrolling and how many people are actually seeing more positive health from using it, we can't really do much.